The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Welcome to the next episode of TMD Demystified. I am Tony Urbanic, and looking forward to talking with you today about a very important topic that hopefully will stimulate you to address the TMD problem that you have in your community. If you are watching this, I assume for the most part you are a practicing professional, either general dentist, oral surgeon, orthodontist, or maybe other dental specialists. If you're watching this, you have some kind of interest in TMD, possibly even patients. But our purpose here, my purpose, and the purpose of my practice for the past 46 years, and especially the past 11 years, treating TMD non-surgically, and my purpose with our company, TMJ Services, is to actually solve, and we have solved, the TMD dilemma. The problem of TMD has not had a consistent, predictable solution since the inception of the diagnosis. Everyone agrees on that. Everyone knows, and that is not a hyperbole. It's not hyperbole. Everyone knows that when it comes to treating TMD, nothing works. Well, we claim and can prove by independent university study and other methods that we have a solution that is predictable and that is successful to the point that 85 to 95% of patients feel it is highly successful, and that 90+% of their symptoms are diminished when used a non-surgical device and protocol properly. That's just the preliminaries to the topic. The topic today is building a TMD-aware local community. Because if you are interested in solving the problem, then you should be interested in actually disseminating the good news as far and wide as possible. At least we are. I am, personally. My staff and my associate doctor are absolutely dedicated to that, and our company is dedicated to disseminating the solution to as many providers and referral sources and patients as possible, because it's a big problem. I've talked about that in other episodes. Roughly 45% of females have temporomandibular joint symptoms that are coming from and derived from and caused by inflammation within the temporomandibular joint itself. And the description of how that occurs and how you can explain inflammation within the temporomandibular joint causing all these disparate symptoms is addressed elsewhere in these episodes. But the point is, we have the solution. I stand by that claim. I ask anyone who wants to dispute it to go ahead and argue with me, criticize what I've discovered here, show how it's wrong. So far, after I believe this is our 80th, maybe 81st, I'm not sure, episode, I have not had one criticism of what I have talked about or presented here factually. Not one. I'm surprised, actually. I'm very surprised. But I want to talk with you today. I want to present my thoughts on actually building a TMD aware community, local community for you. It's possible. I encourage it, and that is what our purpose is within our practice and within our company. So it's actually, as it's turned out over the past 11 years since I've been working on this project, a fairly easy thing to do, step by step. Rome was not built in a day, and step by step, it is actually fairly easy to do. If one wants to do it, the only thing that is required is someone with intention, who has intended to do this. And if you have an intention to do this, with our help, I can teach you and show you and help you in your practice or in your community how to do this, so that you can have your entire community well educated and aware of the problem itself and the solution, which obviously avoids all of the issues that are associated with patients who don't get treatment and the constant misdiagnosis, mistreatment, misdirection of TMD by other professionals who don't recognize the symptoms and misdiagnose, mistreat, misdirect the problem. I've talked about this issue in many other episodes. I don't want to go through that again. But how do you build a TMD-aware local community? Well, we have done it here in Middle Tennessee. Our practice is located in Brentwood, on the edge of beautiful Franklin, Tennessee, Civil War town with a lot of history, and just a beautiful place that is attracting now people from all over the country moving here to enjoy our culture, which is certainly a benefit. But regarding TMD itself, we have made great strides in not only just Brentwood, Tennessee, Franklin, Tennessee, and Nashville, Tennessee, but throughout Middle Tennessee. We draw patients now literally from routinely and from a radius of 100 miles, radius in all directions from our practice. Again, we've been working on it for several years now, and I'm going to go over the steps on how you, if you're interested, and I encourage your interest, whether you are a current network provider using the Urbanic device and protocol, or you are interested in becoming a network provider using the Urbanic device and protocol and help that we offer from our office. I encourage you to build local awareness, which will benefit you, your practice, your staff, certainly the patients, and definitely the community. So I've touched on this in other episodes a little bit, but I wanted to kind of bring it all together today to make the case and show you how this has been done and can be done with ease with our assistance and your participation. So first of all, as a provider, you have to become aware of how it's treated. Of course, we have an online course to do that. And we have much assistance in how to market this from our company. But the actual facts of it are pretty simple. First of all, if you're a provider, you need referral sources. Your referral sources are your best referral sources are other providers, medical and dental providers within your community and within your radius of referrals. And that would include every kind of doctor you can name, dentist, general dentist, colleagues, if you're a general dentist, other specialists, oral surgeons, orthodontists, endodontists, prosthodontists, even can get into hygienists. We haven't even developed that aspect yet. Of course, other physicians, primary care physicians, PCPs, nurse practitioners, physician's assistants, walk-in clinics, our ENTs, neurologists, are primary possibilities for referrals, because they frequently do the misdiagnosis, misdirection, and mistreatment. So that mechanism has been worked out and touched on and actually discussed in detail. I'm not going to do that again. It can be found in other episodes, and how you actually can send out enough information to all of those potential referral sources that they finally, in its educational information, done in a very subtle but professional way, that allows them to understand that how to diagnose TMD, which is very simple. You don't need special x-rays. You don't need special tests. You need a good history and differential diagnosis, use of differential diagnosis concept, and a simple examination of the joint itself, pushing on it. And if it hurts, the joint's inflamed. If the joint's inflamed, you have the diagnosis, TMD. So that's been explained multiple times and is available to you to look at. Of course, and that is actually the low-hanging fruit and the majority of referrals into a practice. Second line of referral is from patients themselves, which is kind of the usual line that at least dentists use, unless you're a specialist. General dentists go after the dental patients themselves, which we'll talk about that in a little bit when we talk about company resources to help you develop an aware local community. And then the third line is what I've deemed eccentric professionals, which I'm not stating that the professionals are eccentric themselves, but they are eccentric to your usual referral sources as either a physician or a dentist, and those would include physical therapists, chiropractors, and massage therapists, all of which come in contact constantly with patients who have the plethora of TMD symptoms of facial pain, neck pain, arm, hand, finger tingling, and numbness, the whole shoot and match, including, Meniere's disease, ringing, fullness, dizziness. And those I considered eccentric professionals, eccentric in their relation to the usual dental and medical referral lines. But addressing and getting to each of these referral lines, again, is the same. After treating a patient, you send out communication, best seen to be snail mail communication, advising the prior doctors and professionals who have seen that patient, exhibiting the symptoms that the patient had and what percentage of the symptoms are now gone after treatment or during treatment or any point during treatment. It spreads like wildfire. It's like a snowball going downhill. You move from 2 professionals, 2 letters that go out to 10 professionals, and then you have half of those send you in patients, and then it multiplies to the point logarithmically to the level that I've stated many times. Currently, we document all our referral sources in Middle Tennessee, sending us, our practice, TMD patients. We have 761 current referral sources who have referred patients in to see us, and we are in contact with them routinely, giving them information about their patients or our company or the problem itself, including sending them holiday cards, Christmas cards. So if you use that method, and we help you with that method, we actually do the majority of that for you in that marketing scheme and system. You don't have to come up with the system in whole cloth. We actually do it for you, driving the patients into your practice with your assistance. You keep track of the patient information and collect the patient information and give us the symptom information and the number of doctors. We can actually, over time, duplicate for you exactly what we've done here in Middle Tennessee. No doubt about it. We're already doing it. We have several doctors who are on their way, who are network providers, who are accomplishing exactly what we've done. So we here in Tennessee, in Middle Tennessee, have made significant strides in making our entire community, medical community, aware of the problem of TMD and the solution. Now, regarding patients, the direction toward patients, the method is completely different. The method toward patients is in 2023, soon to be arriving, is social media. And we all know at this point, if you're paying any attention at all, that social media combined with this device right here brings whatever information or concepts to the public very rapidly if used correctly. So that holds a whole other opportunity, which we have not developed completely, although the company is in the process of developing those systems rapidly, social media systems that we will basically call proprietary, because we'll work out the details of how you develop the social networking to make patients who need this service. We're not trying to sell something that patients don't need. Patients know they're having problems with one or more or all of these symptoms. We see all the time in our practice, I mean, every day in our practice, we have patients coming in, they've been searching for answers for years, 10, 20, 30, I don't exaggerate the numbers, 10, 20, or 30 years with these symptoms, and they have not found anything in one way or another. They finally bump into one of our referral sources who recognizes that the patient may actually have TMD, and they refer them in, and after a short consultation and history and differential diagnosis and a little examination, it's confirmed and then treated properly, which goes on to more marketing. So we have our proprietary methods for doctors, and we have our developing proprietary methods for social media and directly to patients. And we are in the business of sharing those with dental providers who must have dental knowledge to use the device and protocol to bring it into their community on a large scale. Social media use would include Facebook, Instagram, and LinkedIn, and that is where we're directing our resources and our time, along with hooking up with other professionals in the system in videography and different social media methods to perfect that particular avenue. The other opportunity that is available to doctors who want to join our network or are in our network currently is the content that is already existing. Number one on the list of the content that's available is these episodes in the podcast on Dentaltown. Tremendous amount of information that can be dissected out of it and used as information both in developing professional sources and patient sources. Secondarily, I produce a weekly blog that is published on our website, www.TMJ Services of Brentwood, or it also can come to our website by drurbanek.com. Either way, you'll end up on our practice website, at which you'll see a weekly episode or a weekly blog where I write with information that is directed to patients rather than other professionals. And that content is and will be available to all network providers to use as they see fit in their practice, directed toward either professionals or especially patients or potential patients, because that's how it was written. It's written toward patients rather than professionals. We have, I would guess, probably 100 videos of patient consultations that I've made that make specific points of a consultation and teaching doctors the different aspects of a proper TMD consultation and methods that we've honed and perfected here. We haven't even delved into using those hardly at all. I've used them a couple times, but I have literally 100 videos of patient consultations and with patients who have signed off and written their agreement that it can be used for educational purposes. And then we have hundreds and hundreds and hundreds of video and written testimonials that are already published on our website and throughout our location. And any and all of those are available to use for promotional purposes and dissemination and making your community aware of what we've accomplished and what we can do for patients who have the TMD problem. So I think I've really outlined what is available to build this awareness in your community. I think that it is self-evident. I actually shouldn't have to say is why you would want to do this. Now, not every professional who is listening to this, or certainly every dentist in the country, is not going to want to do this. It may be beyond their wheelhouse, or they're so busy they don't have anything else to do. They don't want to do this. They think that TMD is an enigma and an unsolving problem. Whatever their bias is, I'm not going to argue with that in any way, shape, or form. But for those of you watching who actually have an intention of solving the problem and simultaneously building your practice significantly in a good way with a service that is not encumbered by insurance suppression, it's a big advantage to you and your patients, and of course, everyone around you, including your staff and your family. This is what we've developed here at TMJ Services. And I would hope that my brief discussion has stimulated some of you to take further action. Action would be, if you are already a network provider, to help and ask us and enlist in our marketing services, because our company is now translated not just into a company that manufactures a patented FDA cleared medical device for the treatment of TMD, but also a marketing company, helping marketing this device and protocol to other doctors and practices. And so we have a marketing arm, we have a manufacturing arm in the company that can service anyone who wants to participate. And of course, once our network grows to a certain portion, and it is continuing to grow, added another network provider yesterday, there'll be opportunities for the network providers to communicate and assist one another. So it's a network we're developing, not only a network going one way, that is outbound from the company to the providers, but among the providers themselves, if you get the growth of a network. So it's an opportunity for you to grow your practice, help your community, and make them aware of this rather unaware problem that's called TMD. It is given, it is known that throughout our dental community that there is no solution. Everyone knows that. That's what they claim. It is not the truth. So today I'll wrap it up saying to everyone out there, happy holidays, Merry Christmas, Happy Hanukkah, and I hope that each of you have a very successful and creative 2023. If you would like to communicate with me in any way for any reason, I can be reached at Tony@tmjservices.net. Our Director of Marketing and Education, Naomi, can be reached at Naomi@tmjservices.net. And our website for company is www.tmjservices.net. Until next time, I look forward to the time that I can speak with you again. And I am Tony Urbanic, and this is TMD Demystified.